is the World Alzheimer's Day, and I'm here, Dr. Nirmal Surya, President of Indian Federation of Neurorehabilitation, and with me is Dr. Vidya Shinoy. She is a social worker and looking after the people with Alzheimer's disease. She's also representing ADRSI, and she will tell you in the detail. Now, question is, when we talking about 21st of September, it reminds all over the world that it is a Alzheimer's Day. And you all know that Alzheimer's is a dementia, which is 90% of the dementia, and it is a slowly progressive illness affecting predominantly the elderly people. The disease usually start after the 65 years of the age, and it slowly progresses. You all know that there are nearly 55 million people suffering from Alzheimer's across the globe. And in India alone, there are about 90 lakh people suffering from this disease. And you can understand the severity of this disease. And now, what are the symptoms? Why we are worried? When somebody says you got an Alzheimer's, you start worrying, because this is a disease which predominantly link you not only with forgetfulness, that person forgets, याद नहीं रहता है, भूल जाता है. They keep on repeating the same things. They keep on asking the same question. You will know some of those people, if you have come across, you know that they had their tea or lunch. They again keep on asking, मैंने चाय नहीं पिया, चाय पिलाओ. So they keep on repeating the same thing again and again. And then there is a delay or disturbance in the judgment. They make the error in judgment. They make error in calculation. They may give the money to something. They may not be able to judge what is exactly kind of money to be given. Then there is a mood changes. So sometimes they can be very aggressive. Sometimes they can be very different. So there are mood changes which can be leading to the personality changes. So predominantly the person is not aware what day is today, what date is today, what time is today, what is happened, what I did yesterday. They tend to forget the people whom they would have remembered. Even when the disease goes into an advanced stage, the close relative also they tend to forget. At times they walk out of the house, they can't find their own house. They keep on wandering. So these are some of the symptoms which are happen. And since the disease is so slowly progressive, many times even relatives are not able to identify that there is something wrong. They say, okay, he's forgetting, but they don't realize by the time it becomes much more severe when the person is lost, wanting to go somewhere, or night get up and open the door and walk out of the house. That's the time when relatives start realizing that something is gone wrong. So what is the message today? Alzheimer's is a disease, of course, of the age, but as the longevity increases, the more number of people are getting, there's an atrophy in the brain. And since there are amyloid plaques in the brain, the persons tend to lose his brain, the brain become atrophy. But the more important problem is to identify at an early stage so that there can be some drugs which can be given and the relative can be careful before. I remember one of the patients who has given all the money to their servants without realizing, or signed on the will, and then the relatives later on realize that, okay, this all has been done. So they can be careful, protective, preventive, and supportive. Now, what are the treatments? So there are new drugs which are coming, and we may find a couple of new drugs being launched in next 6 months' time. One of them will be available even in India. One has been globally launched last year. And these are the drugs which could be useful at very early stage. So when there is a early cognitive disturbance, that is the time when you start this drug. They may help preventing or allowing the Alzheimer's to come fast. So these are some of the drugs. But there are cognitive therapy support group. So you have the neuropsychologists who can help them giving the brain exercises, some therapy. Now, what is the preventive aspect of Alzheimer's disease? So very, very important thing is you need to take care of your risk factor. That means your blood pressure, your diabetes, your smoking, alcohol, obesity, they need to be controlled. So brain health in general is important. You need to take care of your all the risk factor, should not be having this risk factor. Person must learn new things. So, if you start using your brain, you have never done the music, but at age of 60 years, if you start learning the music, if you start learning the new hobby, that might improve your brain function and delay the Alzheimer. So taking care of the risk factor, as you know that multi-infarct dementia or many of the dementia, Alzheimer and ischemic, so there's a mixed dementia, and you really need to take care of your risk factor. Control your diabetes, control your blood pressure, reduce your weight. If you are smoking, stop smoking. Alcohol should be stopped. And these with regular walk, exercise, yoga, very useful, and healthy diet, they could be helpful to you in preventing the Alzheimer's disease. Now, once you have detected a patient has Alzheimer's disease, now what? So here comes the role of the support group. And that's where I'm passing on to the Vidyaji. She will tell us that those patients who have really difficulties, family has left, patients are alone, they're really in deep trouble, they don't remember what it is. And these are the patients, how they take care, how they communicate, how they support them. So that's where, which is very, very important, because you can't leave these patients on their own. So over to you, Vidya.
Thank you, Dr. Surya. Thank you for actually having this session, because I think awareness is very low, and hence because of the awareness being low, the social stigma is at the same level. Alzheimer's Day is just not one day we look after persons living with dementia. I think we have to be very sensitive to people who have any neurological disorder or a physical disorder by giving extra time, empathy, and patience. Deal with them with patience. Due to low awareness and social stigma, the diagnosis is delayed in India. So if the today's figures say 8.8 million living with dementia in India, I don't think it's just the tip of the iceberg. I don't think it's the right figure, because we don't have any assimilated data at the government level, census data that gives details. And I pray that, the next census will include mental disorders, just not people with physical disability. Once we get the data, I think we will be able to work much better at even the IFNR very, very strong commitment to rehab for people. Once persons are diagnosed with dementia, what happens is they don't know what to do, because the first is a shock to the parents that what's happened to my family member who was probably a lawyer or a banker or a teacher having been diagnosed with dementia. So counseling is very important at this stage. Like, we have to take the bull by its horns and start intervention immediately. If there is a lot of difficulty in accepting, I think we need to have a social counselor or a religious counselor, which they have. Various churches and temples and mosques have these facilities. So once we actually make the family sensitive and aware to what could be the hazards of not attending to the family with dementia, with interventions, therapeutic interventions, I think that's the start of our coming into the picture. We as an organization, Artsy Mumbai, and at the daycare center, Smriti Vishwam, Universe of Memory, I think we are there all the time, unconditionally available 24 hours for not only the person with dementia, but also the family. I think we only think about the person living with the disorder, but I think it's important that in dementia, the person who's living with it doesn't know much what's happening. And that's what frustrates the person. But I think care needs to be given to the person, the primary caregiver, and the hired caregiver, because they need a lot of social, psychosocial help. As an organization, also, we do a lot of screening camps, awareness talks, training for caregivers, sensitization of persons, families having a member with dementia. We also have support groups, because I think there's nothing as bad as somebody not knowing where to go and where they can go. So I think we are always available. And then we come to the rehab facility for the person with dementia. We all know that there are different stages of dementia, and the earlier we diagnose and intervene, the risk reduction levels go, much better. So once we have a meeting with the family, taken all the data possible, social, economic, the past medical history, then customization is very important, because one case is not similar to another when it comes to treating a person. So on the basis of what the information assimilated, we design a program individually. However, I do believe very strongly that group therapy helps a lot, because they know that they're not the only persons traveling in this journey. There are similar people. It's a booster for them, their morale, that, oh, nothing, I'm not any different. There are people like me. So when that comes in, we do group therapy. Also, we celebrate birthdays, festivals, any excuse to celebrate, so that their family member has a good time with us, and they know that we are extended family as much as they are for us. So I think, rehab and intervention is very, very important. And I'm happy that we have you, we have the organization to always fall back on when we are stuck.
Very much for highlighting the group therapy, because group therapy is very, very important. So is the yoga therapy. So some of the yoga, if people can learn to continue, they may help. I just wanted to tell you that this year's theme for the World Alzheimer Day is never too early, never too late. So whenever you wake up, I think that's the time you start working on this. So if you find early symptoms where persons tend to forget, you seem to know that there's some change in personality in the person, or he is forgetting much more than what we all are expected, then I think it's time for you to take him to a neurologist, get him evaluated. There are certain causes which can be treatable. One of them is like dementia because of B12 deficiency. And here the B12 is low, person tends to forget, exactly behave like Alzheimer's. But if you check and give the treatment, that can be completely reversible. So it's very, very important that in anybody in your family at this age of susceptibility has forgetfulness beyond the normal, changes in the mood, personality, and error of judgment and calculation. If these are the early things which are happening, I think it's the time to intervene. And if there are associated factors like blood pressure, diabetes, smoking, alcohol, past history of stroke, I think it's very important that you must visit a neurologist. With those words, I want to thank everybody, and I hope that early detection is the key. And if you find it, go to the neurologist and ask for the various options available so that they can be made comfortable, improve or better in their life. Thank you very much. Thank you. Namaskar.
Thank you.